HIV epidemic fueled by illegal IV drug use put a national spotlight on Scott County, Indiana this year.
A controversial needle exchange program is now in place in an effort to stop the spread of the disease.
WLKY's Lexi Sheen takes a closer look at what goes into the needle exchange, if it's helping, and what's next for a community on the front line in the war on drugs.
Yeah, we just actually walk up and open up the back, and now they're so used to us being there that they wave us down.
Brittany Combs plays a major role in the war on drugs. She's the public health nurse for Scott County, but when it comes to the needle exchange, she doesn't even know her patients' names.
There's not even a place to write their name on
No,
the paper.
no, we don't know their names, not at all.
Participants carry a card with a unique identifier, and no information is ever passed to law enforcement. So far, about 200 people have enrolled. Tim Williams is a former addict and knows their struggle.
The chemicals that are in the pills and what affects your opiate receptors and releases the dopamine, it's a rush that you can't explain.
There are an estimated 400 IV drug users in Scott County. As the use of the drug Opana expanded over the past several years, so has needle sharing and the spread of hepatitis C. Then in late 2014 came an epidemic no one was expecting.
It started with one of our inmates actually being tested in Clark County, I believe, and came up HIV positive.
And then HIV, it just takes one person.
One. Yeah, and it's like wildfire.
This year, 170 people have tested positive for HIV in Scott County.
We had to look at a public health issue. The public health issue is that they are sharing needles and they are spreading the disease.
The health department says it's common for addicts to use the same needle for weeks, sometimes shooting up 10 to 20 times a day.
Those people, the sad part is they don't shoot up to get high. They shoot up to survive and to function throughout the day.
Through the needle exchange, users get as many clean syringes as they need for a week, along with sanitary kits, condoms, and sharps containers for free. So far, the number of needles returned, 32,000, is about the same as the number going out. There have been very few new cases of HIV reported since the program began in April.
It's kind of bittersweet too, because you want them all to quit. You don't want them to have to live like that either. But you just keep doing it, and then you do have those ones that finally come to you and say they're ready to quit, and that's when you know, okay, maybe what we're doing is actually working.
Counseling is a key component of the needle exchange, but the final solution will be a community-wide effort.
The doctors just aren't writing for Opana. The nurse practitioners are not writing. Some of the private pharmacies are not even stocking Opana because they know the issue it's creating in the community.
Tim Williams thinks detox is one good solution.
Jail saved my life.
He's now one of the chaplains at the Scott County Jail.
When I go into the jail, and we used to get high together, and they see me in street clothes and they're in stripes, it's like, how did you do it?
Sheriff Dan McClain estimates 90% of the 110 inmates are there on drug-related offenses. 15% are HIV positive. Now the jail is undergoing a $12 million expansion, adding 136 new beds while they work on a long-term solution.
Getting those programs while they're in jail and then once they get out is going to be key to success in our county for sure.
The Scott County Jail is hoping to adapt a program already in place in Jefferson County, Indiana, called the Treatment Train. The train offers services to help inmates successfully transition from incarceration back to society. The goal is also to help the HIV-positive population stay on medication, which is paid for under the Healthy Indiana Plan HIP 2.0 program. I'm Lexi Sheen, WLKY News.
And the needle exchange program has been extended through May of 2016, and Scott County is paying most of that bill. The health department estimates it will cost about $50,000 to operate it for the next 6 months. No taxpayer money will be used, as most of the funding will come from grants.